Did you know that forgetting simple things, like why you walked into a room, could indicate something more serious than just aging? Have you ever wondered whether you or someone you love might be at risk for dementia? Is there anything that can be done to prevent it? The good news is that there are ways to protect your brain health. But it all starts with recognizing the early signs and understanding the associated risks. Stay with us until the end, as we will also share some exciting new treatments that are bringing hope to millions of families around the world. What is dementia? Think of it as a serious communication breakdown in the brain. Imagine your neurons, the tiny messengers in your brain, trying to send signals, but the connections are damaged or completely severed. Dementia is not just one condition. It encompasses a group of symptoms that affect memory, thinking, reasoning, and even behavior. It's important to note that dementia is not a normal part of aging. Most older adults will never experience it. Yes, it's common to forget the name of a movie occasionally, but dementia is different. It involves forgetting how to perform daily tasks, struggling to recognize loved ones, and losing the ability to communicate effectively. Let's clear up a major misunderstanding. Growing older does not mean you are destined to develop dementia. While it's true that our brains may slow down a bit as we age, and we may occasionally forget why we entered a room or misplace our keys, these lapses are normal. Dementia, however, involves significant declines in memory and thinking that disrupt daily life. Examples include forgetting how to make coffee, getting lost in familiar neighborhoods, or being unable to follow simple conversations. If you or a loved one notices persistent struggles like these, do not dismiss them as just a part of aging. Instead, seek medical advice. Early detection can lead to effective treatments and support. It's important to understand that there are several types of dementia, each affecting the brain in unique ways. Alzheimer's disease. This is the most well-known type, accounting for about 60 to 70% of dementia cases. Individuals with Alzheimer's often experience difficulties with memory, language, and may undergo changes in personality over time. Vascular dementia. This type is caused by poor blood flow to the brain, often resulting from strokes or mini-strokes. Vascular dementia typically impacts problem-solving and decision-making skills. Lewy body dementia. This form of dementia presents a combination of symptoms, including memory issues, vivid visual hallucinations, and movement difficulties that resemble Parkinson's disease. Frontotemporal dementia. Unlike Alzheimer's, this type primarily affects behavior, personality, and speech. A person with frontotemporal dementia might exhibit inappropriate behavior or struggle to find the right words. Understanding the specific type of dementia is crucial, as treatments and care strategies can differ significantly. Recognizing the type can help guide appropriate management and support. Let's discuss some early signs of dementia that many people often overlook. Recognizing these signs early can make a significant difference. First, struggling with words. While it's common for anyone to forget a word now and then, dementia takes this to a whole new level. For example, someone might struggle to say watch and instead refer to it as that time thing on my wrist. If a person frequently hesitates, uses vague phrases, or replaces words, it's important to take note of this behavior. Second, changes in senses. Did you know that dementia can affect the senses? Individuals may have trouble recognizing faces, judging distances, and may even lose their sense of smell. They might stop enjoying foods they once loved because their taste buds seem altered. Third, losing interest in hobbies. Have you noticed that a friend who used to love reading no longer picks up a book? Or that your chess partner has lost interest in playing games? Apathy is a common sign of dementia and is often mistaken for laziness or depression. Fourth, muscle weakness. Difficulty with tasks like buttoning a shirt or experiencing frequent falls could be linked to dementia, especially types like Lewy body or vascular dementia. Don't ignore these minor motor changes. They could be early warning signs. Fifth, changes in posture and walking. If someone begins to shuffle their feet, take tiny steps, or hunch over, it may not just be due to a bad back. These alterations in movement are often associated with certain types of dementia. Here are 13 classic symptoms of dementia. Number 1. Avoiding social interaction. Fear of embarrassment or confusion can lead individuals to withdraw from family and friends. This social isolation can worsen cognitive decline. Number 2. Incontinence. Difficulty recognizing the need to use the bathroom may result in accidents, which is common in the later stages of dementia. Number 3. Hallucinations. Seeing or hearing things that aren't there is common in some types of dementia. These vivid experiences can feel very real to the person. Number 4. Trouble solving problems. Simple tasks, such as cooking or paying bills, can become challenging. Planning and decision-making may feel overwhelming. Number 5. Short-term memory loss. Forgetting recent conversations or events happens frequently, while long-term memories may remain intact. Number 6. Losing things in strange places. Misplacing items in odd spots, like putting keys in the fridge or shoes in the oven, becomes a common issue. Number 7. Mood swings. Sudden shifts from calm to irritated, or episodes of unusual sadness may occur. Emotional changes can be unpredictable. Number 8. Getting disoriented. Forgetting where one is or what day it is can be unsettling. This confusion affects both time and place, disrupting daily routines. Number 9. Struggling in conversations. Losing track of what is being said, or forgetting words, can make discussions difficult. Crowded settings may amplify these challenges. Number 10. Poor decision-making. Wearing winter clothes in summer or falling for scams are signs of impaired judgment. Decision-making becomes unreliable. Number 11. Inappropriate behavior. Outbursts, odd remarks, or impulsive actions may happen. These behaviors are often beyond the person's control. Number 12. Repeating questions. Asking the same question repeatedly occurs because new information does not stick. Number 13. Confusion about time. Thinking it's yesterday or believing it's still morning when it's actually evening reflects this symptom. Days and years may blur together. If you observe more than one of these symptoms in someone you care about, don't hesitate to reach out to a doctor for guidance. Here's the exciting part. There are steps you can take to protect your brain health starting today. 1. Keep learning. Challenge your brain by learning a new language, picking up an instrument, or trying puzzles. The more you challenge your mind, the stronger it remains. 2. Manage stress. Chronic stress can shrink areas of the brain linked to memory. Consider practicing yoga, mindfulness, or simply going for a relaxing walk. 3. Control diabetes. High blood sugar can damage the blood vessels in your brain. Keep your levels in check with a balanced diet, regular exercise, and medication if needed. 4. Watch your weight. Excess weight during middle age can increase the risk of dementia later in life. Small, steady lifestyle changes are often the most effective. 5. Quit smoking. Smoking reduces blood flow to the brain. If you quit, your brain can start to recover immediately, even if you're in your 60s or 70s. 6. Exercise regularly. Even just 30 minutes of walking can increase blood flow and help protect your brain cells. 7. Stay socially active. Join a club, volunteer, or call a friend. Loneliness is a significant risk factor for cognitive decline. 8. Build cognitive reserve. A more educated and mentally active brain is better equipped to handle aging and disease. 9. Eat for brain health. The Mediterranean diet, which emphasizes fish, nuts, fruits, and vegetables, has been shown to reduce the risk of dementia. 10. Sleep well. Your brain clears toxins while you sleep. Create a relaxing bedtime routine to improve your rest. While there is currently no cure for dementia, science is making significant strides. Medications are improving quality of life and slowing the progression of symptoms. Cutting-edge research into gene therapy and immunotherapy is exploring ways to address this disease at its roots. Therapies such as cognitive stimulation and occupational therapy are helping patients maintain their sharpness for longer. Remember, you have the power to protect your brain. Start by recognizing the signs, making small lifestyle changes, and staying curious. Don't forget to subscribe to our channel. Like this video and share it with someone you care about. Together, we can create a brighter, healthier future for our minds and hearts.